But Dr. Ferguson, do you want to kick us off? Or?
Yes, that would be great. Welcome PAC students and MSW and BSW students more generally. My name is Kristen Ferguson. I'm the co-chair of the PAC concentration in our MSW program. And I'm delighted to have three PAC alumni, very esteemed PAC graduates from our program over the last decade, out there doing the skills and competencies that you all have been learning about in the last year plus of your MSW program and PAC program. I'll go ahead and just briefly introduce the panel to you and just want to reference you to Handshake, where you'll find the panelists' bios as well as contact information if you'd like to reach out to any of them. First, I have Cameron Cobb, who is the Senior Manager at Banner Health Plans, and is leading the policy implementation, program development, and services for children and families enrolled with Banner's Integrated Physical and Behavioral Health Access Complete Care Plan. His priorities include increasing school-based behavioral health services in schools, as well as promoting effective community-based service strategies and enhancing referral pathways from primary care physicians to behavioral health providers. He has over 10 years of experience in behavioral health that includes working as a children's case manager and liaising with providers in some of our rural communities of Southern Arizona. He did earn his MSW in the PAC concentration from our school, and he also teaches in our PAC concentration as well as a faculty affiliate. Next, we have April Reed, who's the Vice President of Advocacy and Designated Legislative Lobbyist at Ability 360, a disability serving organization and advocacy organization here across the state. In this role, April creates programs that empower individuals living with disabilities and their families, including advocacy-related workshops, different types of one-on-one mentoring. She facilitates wellness groups and provides technical assistance to customer-driven initiatives, as well as developing community partnerships that address the barriers to consumer choice, equal rights, and self-determination for our disability communities. She also supervises a number of different programs, including a 65-member peer mentor volunteer team, a benefits to work program for Social Security beneficiaries working or seeking employment, and the This Is My Life self-advocacy educational program for individuals receiving services through the Arizona Division of Developmental Disabilities. Like Mr. Cobb, April also received her MSW from ASU's PAC concentration. And last but certainly not least, we have Angela Schultz, who's the Director of Constituent Affairs for Senator Kyrsten Sinema's office. In this leadership role, she assists the Senator in building and maintaining relationships with a host of different local leaders, community organizations, and she works continuously to monitor local issues with an emphasis on healthcare, economic stability, veterans, military, border immigration, and she communicates the range of these issues to staff in Arizona and Washington, D.C. She oversees a team of constituent affairs representatives who maintain a caseload and draft case plans for constituents with needs relating to federal agencies. She previously held a similar role in the office of then Representative Sinema at the state level, and her priority leadership roles include serving on the NASW Arizona board, as well as serving on Outreach and Community Development Manager for Arizona's Community Action Association, now called Wildfire. Like the other two panelists, Angela also earned her MSW from ASU's PAC concentration. I'm delighted to now turn over the presentation to Natalie McIntyre, who will begin the panel discussion with our employers.
Thank you so much, Dr. Ferguson. So we'll go ahead and jump into our questions at this point. I do want to point out that we would love to spend the end of our time here today doing some question and answer. So feel free to use the chat feature throughout the panel. And if you are a PAC student, we would love to first address those students' questions. So if you could designate that even in front of your question that you are a PAC student, but we hope to get to all of the questions. But again, my name is Natalie McIntyre. I'm a career and industry specialist here at ASU in Career and Professional Development Services, working closely with our Watts College of Public Service and Community Solutions and our PAC students as well. But so great to have you all here. Thank you for joining us. Thank you for joining us, panelists. I do just have a few questions that we'll start with here today. So, and I'll go ahead and address our panelists. Cameron, if we can go ahead and start with you. And our first question is just being, what types of leadership skills would be helpful to employers, to our community partners in implementing COVID-19 response strategy?
That's a great question, Natalie. I think in talking to other leaders, just in really being thoughtful about how I manage my team and work with other leaders, I think that a lot of folks who get into social work are interested in solving social problems, or just interested in solving problems in general. And I think that COVID-19 is certainly a large social issue, a large systemic problem. I was talking, though, to some other leaders yesterday about just being here today and speaking on this panel. And some of them made the comment that adapting and changing their leadership style and working with their teams in this new environment has been a challenge. But it hasn't necessarily been as much of a challenge as working with some of the other social issues that they encounter day to day. So things like pervasive challenges with mental illness with individuals and families, things like schizophrenia, schizoaffective disorder in children can pose a number of challenges that they're working with at an agency and a societal level day to day. So to them, they said, yes, this has been one more thing to manage and to deal with. But they talked about just being adaptable and being willing to try new things, really just listening to their teams, listening to the members that they serve, and really just figuring out how can we better do our job, how can we better serve the people, the members that we work with day to day in a way that meets their needs, and also at a time when we have, sort of these new challenges being posed to us. So the sense that I've gotten in the behavioral health and integrated side of things is that certainly this hasn't been easy in some areas, but as a whole, social workers and the people in our field are really here to try to overcome barriers and to solve problems. And this, in a sense, has just been sort of another bump in the road, if you will. So I think a desire to, expressing a desire to solve problems, being adaptable, and just being thoughtful in how you're going to approach different types of scenarios. If you're able to really show that you can excel in those areas, I think that those would be valuable areas to focus on, just in conversations with people about job opportunities, as well as in like an interview setting.
Great. Thank you for sharing that, sharing those skills. April, would love to hear your thoughts as well from your perspective.
Well, I think as a supervisor, whatever role we're doing as a social worker, whether it's supervision, running a team, we always go back to our values and ethics. And so for me, I always try to really create and foster a team. And I've been lucky to have social work supervisors who did that for me, created teams where open communication and transparency and peer support was a part of our daily interactions with each other and our daily dialogue. And so, I don't function as a supervisor unless I have a team that cares about each other and that is on a good day interacting well and supporting and helping each other to accomplish the goals and the mission of the agency. And so, I think what the pandemic has done is it's really reminded me how important that foundation is and was, that we have that, because our team has been able to transition. And I think we've been able to do that pretty smoothly because we interact continuously with each other, and none of the events or activities we do happen without each of the team members. So, you know, that relationship, that authentic communication, the transparency, all of that is carried over into our work. Now, doing that remotely, it's essential that we have really good communication skills right now because we're not seeing each other every day. And it's essential that we're checking in with each other and being supportive, and, you know, stepping in and helping each other, because we still have requirements of our grants. We still have projects that we have to get done. And so we're able to do that because of just the team that we create together. And I also, for me as a leader, you know, I'm reminded that, you know, it's my job, just like we would with our clients, it's my job to listen and be supportive of my staff. And sometimes that means, you know, they're calling and debriefing, or we're talking through a challenge with a project, or we're talking through a challenge with a client, or we're talking about their own frustrations. You know, a lot of my staff, a big part of their day is listening to clients who are overwhelmed and frustrated, and because of their disabilities, face challenges that are increased because of the pandemic. And so, you know, really supporting my staff to be mentally and physically and emotionally able to support our clients is an important part of what I can do for them as a supervisor, and creating space for them to laugh and vent and you know, support each other is one of the things I can do. I don't have answers sometimes. I don't have solutions to all of the issues that we're facing, but I think knowing that, you know, we have a space where we can be transparent and support each other has been really important. And I think that's what leaders do in these times, is really rely on our social work values and ethics to guide us about, you know, a leader is calm, a leader is transparent, a leader is supportive, a leader is empathetic. Those are ethics we follow all the time, but certainly in times like this, we rely on those values even more.
Excellent. I think it's great to hear how so many of those skills are so foundational, you know, just in a normal setting, but with this pandemic, how that's been increased to have those communication skills. That ability to be adaptable is so important. Angela, I'd love to get to you as well if we have you on the phone, if you'd like to speak to those types of leadership skills that would be helpful right now during this situation. Angela, do we have you on the phone? Make sure. I think you may be muted. Angela, are you there?
I think you guys just unmuted me. Can you hear me?
We got you. Thank you so much.
Okay.
We'd love to hear your thoughts.
I was just saying, I would agree with what was already mentioned. I think for my role in particular in working with the federal government and all the new legislation that's being passed right now, there's a lot of uncertainty about what's going on. And it's Congress's rules, or it's their role to pass the bills, but then it's up to kind of the federal agencies and the state agencies to implement it. So kind of while you're in that frame of waiting, we have a lot of people reaching out to us for help. And I would echo what was just said. I have a great team. We work really well. And so communication is really key. I think understanding too, when you're supervising other people, right now we're going through something that nobody's really ever experienced. Nobody ever has. And so also understanding that the people that I'm supervising might react differently than how I am reacting, and that I might not know everything that's going on in their life or how COVID-19 might be affecting them. So just trying my best to support them and help them, as well as also working on my own personal self-care. As far as working with the community partners, just really being adaptable. And I would also say communicating with people. So we don't have a lot of the answers, but at least we are reaching out to people when people are coming to us with concerns, letting them know, we share your concerns that you have. We don't have an answer right now, but we're going to work to get it for you. And then following up with those people later on, whether it's a week or 2 weeks later, letting them know if we have any sort of updates for them. If we don't, we have found that to be very successful, and just letting people know that we're working the best that we can to try to help them. And then as well as, I would say, being willing to be a team player. So we have shifted a lot of responsibilities in our office, and people who work on our policy team, they're taking phone calls with Arizonans from DC. People who typically don't help out in the constituent services end, they're helping us kind of, respond to people about more constituent affairs issues. And so it's just really being able to kind of jump in and play a role wherever you can to be helpful, is kind of what I would really stress.
Great, thank you, Angela. And at this point, I would encourage our participants as well to continue using that chat feature, as we do want to address questions that you may have in addition to these at the end. But moving to our next question, I'd love to start with you, April, and that's thinking about obviously our students, our upcoming graduates, are job seeking at this point. If you have thoughts or would like to speak to in what ways is this COVID-19 pandemic affecting agencies, particularly hiring strategies right now?
Well, that's a good question. I would say in some ways we maybe don't know yet, because so many things are up in the air. It really depends on the particular agency. Some agencies are going to have some influx of funds because of the federal monies that are coming. And so they may be able to hire positions they hadn't planned on because they know that they're going to have to serve more people who are impacted by the pandemic. It really is very specific on funding. Even at Ability 360, I can use us as an example. Some of our programs, we've heard from grantors that are hugely supportive and say, work from home, we trust you to be able to serve the clients and to meet the goals of the grants. Doing that from home, just be in touch with us. And so, we haven't seen funding cuts. Other services at Ability 360 are considered essential services. And so, for example, our home care services program that is funded by All-Tex, that's an essential service. If our caregivers, we have about 2,000 caregivers in Maricopa County, if they are not there to help someone get out of bed in the morning and help with cooking and cleaning and whatever they need in their home to be safe, people will not live, people will die. And so that program has to continue. And so it's our responsibility, our mandate, our ethical responsibility to ensure that that program continues. And so we are doing everything possible to make sure that our caregivers are safe and well, that the people we serve are safe and well, and that that essential service continues. So, I think as far as hiring, I don't think you should make the assumption that all programs are going to be impacted in one way or be impacted negatively. I think you really have to look at the population you're going to serve, and seniors and people with disabilities and people, our homeless population. Those are going to be populations that are in critical need, and so the demand and the funding for hiring social workers may be increased right now. So I don't think you can make assumptions. I think you have to think about, where am I going and what kind of work do I want to do, and look really carefully at the specific agency you're interested in.
Thank you for sharing that, and thank you for sharing that perspective. I'd love to move to Angela next about any thoughts you have surrounding hiring strategies right now.
Yeah, well, first of all, I just want to say to everybody who's graduating, congratulations, because that's a huge deal. So again, I would agree with April and say, so our agency, just so you guys know, we are actually hiring some social workers right now. We have decided, well, the senator decided to rearrange our budget, and we hired additional staff. So we hired, I think, 4 additional staff assistants, and then 7 additional MSWs. And we've already brought on some, but we're still looking for some additional people if anybody's interested in applying. We do sit on a lot of calls with nonprofits to kind of hear how we can be, how we can assist them. And I would say it's kind of the same. Some of the nonprofits, it sounds like they are struggling because they had planned to have their like annual fundraiser in person coming up. And because of COVID-19, they had to cancel that. So they're trying to be a lot more creative in how they can raise money, if it's possible to do some sort of online fundraisers. So some are doing well, and similar to what April said, some services are deemed essential, and so they are going to be hiring for those positions. And then other nonprofits I've talked to have had to furlough staff or let staff go just because their funding has ran out. So it's really up to each agency. And I would just say kind of what we talked about in the first question, just the importance of being able to, if you're, you know, it's fine to be focused on getting kind of like your dream job, but also be open to like, is this a step in the direction that I want to go for right now? Because I might be able to do some of what I want to do, but I might also have to take on some other responsibilities that I wasn't quite interested in previously.
Great. Thank you for sharing those opportunities as well as the different agency responses that you're seeing. Cameron, would love to hear your perspective as well.
Sure. Yeah, I definitely agree with what has already been said. And I also reached out to a number of the agencies that we contract with in the behavioral health and the integrated health space. And I have not talked to anybody who said they're like putting all hiring on hold at the moment, at least of the contracted agencies that I spoke with. So a lot of them talked about the sort of transition to telehealth services or through like Zoom or over the phone, things like that. I've talked to agencies that have said that they've actually had increased success rates in you know, getting people to attend therapy consistently and things like that, which has been really nice. I think this this whole situation with COVID is probably going to push us to adapt a lot of telehealth technologies a little bit faster. We've seen that on a state and on a federal level that they've relaxed some requirements with telehealth services. And so I think that might be some silver lining that comes out of this. So I think that in that way, it has changed the way that some agencies are providing service and the way that they're approaching serving members and families and things like that. But I have not really heard of agencies that are just putting like a hiring freeze across the board. So I really like what Angela said about maybe it won't be exactly what you wanted right away. Maybe it'll incorporate, like the type of position you find will incorporate some of the things you're really interested in. But just because this is a strange time and we don't know what tomorrow is going to look like, let alone, you know, next month or, you know, the end of the year, that maybe a willingness to maybe take on some other job roles and areas as part of the job that you get. Maybe some of those aspects would be different from what you thought you would be doing. So I think that just an openness and you know, a desire to learn will come across far, and agencies are looking for people to be adaptable right now.
Absolutely. Yeah, thank you for sharing that piece of advice as well. I'd love to move to our last question, and Angela, we'll go ahead and start with you on this one. But that's looking at macro and micro positions. So do micro, thinking about those clinical positions, or macro, maybe that program development, research evaluation, grant writing, policy analysis, management, etc. Positions have equal importance now? Or would you say employers are looking for more or fewer of one type of position versus another?
I would say, in my opinion, they're pretty equal importance. So we have lots of people calling in who are writing into us, who are just grieving the loss of loved ones, you know, in a complete state of panic and really need more of the clinical side of things. And I know we've been referring to all the crisis lines, and it's on my list of things to do is reach out to the different crisis teams and make sure they're doing okay and if they need additional support. But also I would say the macro is equally as important. You know, agencies cannot run if they don't have funding. So if you can do fundraising and grant writing, that's all great. We keep referring this as kind of like the new world that we're in. So government has very much changed the way they operate. So if you have skills that you're able to do policy analysis or research kind of what the different things are that are changing, that would be a huge benefit. Even within like the rules within the different agencies. So we have been doing a lot with DES, trying to implement unemployment insurance, but also being aware of the rules that DES is changing within the agency and what the governor has changed as to like who might be eligible now to apply for SNAP, which is food stamps, and being able to kind of, you know, figure out what resources are available would be a huge asset to any sort of agency because everything has completely changed from how it was a month ago. In addition, I used to do program development, and I just see there's probably going to be programs that go away because of this, but then there'll also be, I imagine, like a huge opportunity for new programs to come out of this because, again, we've never been through this. So ways that we can work kind of within what the new setting will look like.
Thank you for sharing that. Cameron, would love to hear if you have maybe similar or different perspective on that.
Sure. You know, I think it really just depends on the agency. It depends on the types of changes that they've made to accommodate, you know, what is needed in this new environment. I think that if students, soon to be graduates, if they talk about even just the transition that they experienced academically and in their internship, you know, moving from in-class teaching to an online model, you know, that type of experience, I think is meaningful. Talking about potentially any changes they experienced at their internship also would be valuable. So I think that depending on the agency, you know, it's possible they may be shifting in one way or another. And to Angela's point about, you know, it's possible, unfortunately, that some agencies may not be able to survive this. There are going to be other agencies that do survive this and are looking to potentially merge with agencies that were not able to survive. They could take on programs from other agencies that still need a home. That's something that I imagine we'll see a little bit of at least. And I think things will move quickly when we're able to get back to some semblance of normal. So I wouldn't say that, you know, there's not really like a hard and fast answer to this. I think it's going to really depend on what each agency wants to do during this time, how they're responding. And I would say, just to echo some of what's already been said, if soon-to-be graduates are looking for an agency or a nonprofit that really aligns with their culture and their belief system and their ethics, that's the way to go. I think that if you start out even in a position that might be a little bit different from what you envisioned, but you're at an agency that you really, that really aligns with where you want to be and aligns with what you believe, that those opportunities will present themselves as you continue to work hard and be a part of that agency. So I would say the type of company that you want and the culture and the belief system is really important. And if you feel like maybe the job isn't exactly, or the role, the position isn't exactly what you wanted, but the agency is right, I feel like, you know, that would still be a good place to start. And I think that you'll be able to find more of the types of job skills you want as you move forward. That would be sort of my perspective.
Excellent. Thank you for that. And then April, if you'd like to share your perspective.
Well, I think my perspective would be that the demand is the same for micro and macro positions right now. You know, as things were, you know, events or things that my advocacy staff would really help plan, as those went away, I think we were all expecting for this strange lull of our time. But at the same time, all of these pieces of legislation and bills and funding was changing constantly. And so there was a whole host. We weren't doing events, but we were advocating in a different way and educating in a different way, and had a whole host of new opportunities to do that and to meet those challenges. And so at the same time that our direct service staff were working with clients one-on-one and really supporting people in getting basic needs and supporting our work there, our advocacy staff and our macro staff were really having to step up and really having to get educated on a ton of legislation and be prepared to speak up for people with disabilities as a community as a whole. So for one example, you know, one of the challenges that COVID-19 has brought in is the awareness that we don't have enough medical supplies, and that those services are limited. And so immediately people with disabilities are going to be impacted by that. And so we were hearing concerns in the community about people with disabilities being denied services, or being told that that they might need to sign a do not resuscitate order in order to get services, or that choices were being made, or people were being communicated that the choice would need to be made that their health was less valuable because they had a pre-existing condition than somebody else. And so we are immediately having to remind lawmakers and policymakers and administrators that, you know, under the Americans with Disabilities Act, you cannot discriminate against somebody with a disability. And so that was an important way for the disability community to immediately come together and have a voice and be able to advocate. And that wasn't a challenge that we were expecting, but that was a challenge that arose and that we needed to address. So I think that both are equally important right now. And I think depending on the agency or the environment of the organization, it could change about what their focus is. But for organizations like us that do both, we've even found many opportunities right now that my staff are working on program development because we've had to change the way that we were going to teach a class. So now we're rewriting curriculum. So all of those things are requiring us to be flexible and adaptable, I think is a good word. It's requiring creativity to meet those challenges. But I think that all of those positions, depending on the agency, could be needed and could be called upon.
Absolutely. Great. Well, thank you guys for sharing your perspective, even your eagerness to embrace even the challenges that have come with this time. I know your insights, your perspectives are so valuable, invaluable to our participants here, even our May 2020 grads. But at this time, I would love to open the floor up to Q&A, and I'm going to go ahead and defer to my colleagues to see if we do have any questions coming in via chat, and then we'll let our panelists kind of take those as they'd like.
Thanks, Natalie. We do have a few questions. So first question is, as a PAC student that is graduating in May, I have a few questions. What is a realistic position for a new PAC graduate? And number 2, should I be looking for a job right now, or should I wait until things go back to normal? Is it realistic to look for a job during the pandemic?
This is Angela. Did you want us just to hop in?
Just anyone who would like to grab it, go for it. We'd like to
Okay,
hear all your opinions on it.
So I would say that it is realistic to look for a job right now. I do know, like I said, we're hiring. I know other agencies are hiring. I just saw a thing in I think it was the New York Times, and they listed all the essential workers, and social workers were like a huge amount of it. So I would say that it's realistic. Like we said earlier, it might not be like the dream job that you hoped for, but what I have found when I graduated from school, I took a job that I was interested in. It wasn't my dream job necessarily, but I learned other skills from that I was able to take to my next job that helps me get the position that I'm in now. So where other people I went to school with kind of like waited until they found the job that they really wanted to apply for, and kind of got behind me several years in kind of where they wanted to be. And for looking for PAC jobs, I would also just say to maybe what I did when I graduated was I kind of like looked outside of where you might typically look. So when I moved here from Michigan, and I went on jobbing.com after I had my BSW, and was able to get like a job doing case management that way. And when I graduated with my PAC degree, I started just throughout my ASU time, I had spent a lot of time trying to network with other agencies during my internship or volunteering. So I went on their websites and I looked to see if they were hiring different positions. And then I also, my first job was actually at the Maricopa County Public Health. So, make sure that you're checking like the city websites, the state websites, and then also, like I said, just go to different nonprofits or organizations that you know of and look to see if they're hiring right on their website. And just know that sometimes I felt like if I was applying for a job, my first job was actually in policy with public health. And I thought that I was a little concerned if people saw my MSW, they would just think, like, oh, she works with kids or she does therapy. So really making sure that what you are putting on your resume matches up to what the job is requesting. And then when you do your interview, making sure that you've thoroughly researched what you're applying for and how you should do your interview. Because even when people ask me kind of, generic questions, like what does the typical day look like? I do all our hiring. I appreciate that they have thought ahead of time to get those questions to ask during the interview versus when I say like, oh, do you have any questions? And they're like, no, I think you answered it all. So doing the basic stuff that like, sending thank you letters when you receive an interview, I think that really goes a long way. It shows that you have good etiquette.
Cameron or April, would you like to chime in on that too?
Yeah, I could take a stab at that one if that's all right. I really like what Angela just shared, and I the way that I approached it as I graduated was I wanted to find the job that would allow me to what I thought maybe learn the most. So I approached it from the perspective that a lot of my experience in the behavioral health realm at that time was related to Maricopa County and working with providers that I was already, I knew providers, I was in a metro area. I felt like I had a fair understanding. And the position that I ended up pursuing and ultimately getting was with Simpatico, which was Regional Behavioral Health Authority, so kind of like a behavioral health insurance company that focused primarily in rural southern Arizona. So I got to learn more about what it's like to deliver services and meet the needs of people who are in rural communities. And I was working primarily with providers that I knew almost nothing about. And that allowed me to really, I would say, increase my knowledge in a lot of areas about not only serving people who live in rural areas, but just learning about different organizations and the way that they do business. And looking back now, I don't think that I would have the job that I have now if I'd just stayed in Maricopa County the entire time, because the health plan that I work for that's part of Banner focuses on both central and southern Arizona, and a lot of the skill set that I've been able to bring to this position, and probably one of the reasons that I was hired is because I knew both metro areas and rural communities. So I think it's great if somebody knows what their dream job is and is able to go after that as you're graduating. I think that's wonderful if that's something that you can do. But if you're still not sure what your dream job is, or what it is that you want to do, I would say go after opportunities that are going to allow you to learn a lot. And to answer the question more directly, should you wait? I would say no, because we don't know, again, like what tomorrow is going to look like or next month is going to look like. I think that it's a different time to look for a job, than is, the standard day to day. But I don't think that it necessitates waiting, or I don't think that you're going to have a challenge, finding available positions that need sharp minds who bring new ideas. So I know in the healthcare sector, like for full transparency, like if you wanted to work Banner or some of the like the hospitals, and it's like, this is a challenging time for the health sector right now, because of the way that they put a lot of elective surgery and things like that. And so some healthcare companies, Banner included, are experiencing shortfalls, and they have put some hiring on pause. So that might be an example of a space that might be more difficult to get into at the moment, but I still think that if that's your passion, you'd probably be able to find something. It just may not be exactly what you thought you were going to pursue, as you graduated. So I would just say, be open. I know a lot of people are hiring, and I think, if you convey the type of skills they're looking for, and good energy, and you're hardworking, I think that you'll be just fine.
There was actually, Angela, a follow-up question to that question was, where would students apply for positions at Kyrsten Sinema's office? Is that something that you could tell us?
Yeah, I think you said my email is in the Zoom system somewhere, correct?
We do have your information in Handshake, and we do have your email. So would you like us to share that, or?
Yeah, you can share it. And then if anybody is interested, they can email me, and then I can send them the job description. And if they're interested, then send me a cover letter and a resume.
Awesome, thank you. All right. Sarah Jo, did you want to go with our next question?
Yeah, absolutely. So another question that we had come in from the students that are here with us today. So a question based on ethics and kind of being a little bit more investigative about the organizations that students might be interested in. This student asked, is there a way to investigate the values and ethics agencies have other than looking at their mission, their vision, or their value statements? Would you have any suggestions to that? Which one of our panelists would like to speak first to that?
This is April. A couple ideas there. I mean, I have students reach out often to me at Ability 360, and they're not necessarily looking for work here, but they're looking and working in some way with people with disabilities or kids with disabilities. And so, they'll just come meet and pick our brains about organizations or services. And just to kind of understand, you know, it's a lot of us work with populations where it's a small community ultimately, you know, and we can kind of give you suggestions or thoughts about organizations or services or programs that are doing innovative work. So, you know, I would say some of your professors right now will have some of those kind of contacts and will know organizations, but you know, don't feel shy to reach out to an organization if there's a social worker there. You know, so many social workers, I've benefited from their experience and their mentorship. That's a talk about a value that we hold. You know, that's often, you know, some of those longtime social workers will see it as a fun opportunity and a responsibility to help mentor you. And I benefited from that a lot from longtime social workers. So, you know, be brave and, you know, reach out to a couple of organizations if you see there's a social worker, you know, at that organization or at an adjacent agency that maybe you can pick their brain and find a little bit more of that insider information about who they are and what they do and what's their community reputation.
This is Angela, and I would just say I agree with that. But I would also think about like who, in addition, I think you guys have a great resource with all your professors at ASU, but also think about who your references might be and check with your references. I have really great mentors, I would say, who would never really say anything bad about an organization. But I can also tell when I tell them like, oh, I was going to apply at this place. Would you be willing to be a reference? They're like, sure. Versus if I say like, oh, I was thinking about applying at this place, you know, would you be a reference? And they're like, oh, that's a wonderful place. And this person there will be so great. So you can also kind of tell that way just by asking questions and having conversations with different people in the community. I think April said it. It seems like we have a large community because Phoenix is big, and I know probably not all of you live in Phoenix. You might live in Tucson, but a lot of people know everyone. So.
Yeah, I definitely agree with that. I taking advantage of your social network is helpful, and even just utilizing LinkedIn to see, you know, if you know anyone who works at a particular agency and to pick their brain about their thoughts.
Yeah, absolutely. I think that's great that you all touched on networking and getting insider knowledge. That's a great way to get more insights on that. We do have another question that came in. A student's asking, when I imagine doing beginning jobs that might not be what we consider we want to do directly with PAC, I imagine doing direct practice work. They give examples of case management, counseling. Is there another beginning type of job that is still macro that would be a valuable lead into other macro opportunities that doesn't require direct practice, i.e. maybe marketing, PR, politics, lower government work?
This is Angela. So I feel like when you're in the PAC program, a lot of times there's this like fear that there's not a PAC job available for you when you get out of school. And it's kind of interesting because sometimes I hear from the direct practice students that they feel like there's more PAC jobs available than direct practice. But since graduating with my PAC degree, that was also my fear, is that I was applying for whatever because I just needed a job. And I was also afraid that I would end up either A, back in case management, or B, I had worked in behavioral health before with children, and it was just a very stressful job. So I was looking at maybe being a supervisor in that role, which wasn't ultimately what I had wanted to do. I was much more interested in policy and community organizing. But I have never held a job not related to what I was interested in since graduating. So like I said, my first job was at Maricopa County Public Health. And I think I was called like a prevention specialist. And I would not say like, again, when I say it might not be your dream job, I did tobacco prevention with youth, and then also when ASE went tobacco free, we helped them kind of implement that. And so while that wasn't necessarily something that for me personally, I wasn't super passionate about that topic, but I learned a lot of the skills that helped me get other jobs moving forward in advocacy and, researching policy and figuring out kind of, what the pros and cons of implementing policies can look like. So I do think that those jobs are out there. It kind of depends on, I feel like, how badly you need money. Everybody's probably in a different situation. But I do feel like there's lots of entry-level PAC positions available.
I know that the state of Arizona has a lot of positions available, that some of which may be similar to what Angela was just describing in the PAC space. I also will share that in the behavioral health and healthcare space, a lot of companies are looking for someone that has at least a good general understanding of direct practice and has done some of that work. So kind of back to what I was sharing a little bit ago, if there's just a little bit of an openness to maybe do a hybrid role or to learn more directly about the direct care level that involves, could be behavioral health, it could be integrated health, something like that. Some of the leaders that I spoke to said that what we would consider more of like PAC jobs in the behavioral health and integrated space, they end up not even having a chance to post externally because they usually find themselves promoting from within. So people who've started out in some of those direct care roles that have more of an interest in administration or policy or community will end up taking those jobs before they even get posted externally. So just something to consider, but that's my experience is more so from behavioral and integrated health. That certainly doesn't extend beyond that.
April, did you want to add anything to that question?
Well, I guess I was just thinking, I meet a lot of other PAC professionals that in the beginning did kind of a hybrid job, and we actually found that really helpful. And so that when we're advocating or writing curriculum or developing a program for a group or the we really rely on that experience of working directly with that community. So I would say, the hybrid jobs, I was always worried about being overwhelmed doing direct practice. I found that really just challenging work. I loved it, but I knew I couldn't do that full-time every day, all day. But I didn't want to give that up completely. I knew there were things that I needed to learn from working with people one-on-one. And so I always looked for beginning jobs that gave me that experience to really understand that community and have the benefit of working with them directly. And I've always found it helpful. And I know others who have, as I've said. So I think those hybrid jobs, where you're getting a chance to develop your PAC skills, but also getting that invaluable one-on-one experience, you'll use that as you step into your next position, which may be fully PAC. But I wouldn't dismiss that experience. For a lot of us, it's really helpful as we go on to advocate or program develop.
Awesome, great, thank you so much. So I have another question that came in. It's from Kristen. She said, I often get questions from students about negotiating salary. So can you give some tips about how students can successfully negotiate salary once a job is offered to them and salary is discussed, knowing fully well that, students might have some concerns about the fact that we're in a pandemic and funding might be tight, or, it might be their first job out of school and they might not be bringing in enough full-time job experience skill sets. What would your advice be on that?
I can start out with that one. This is always a little tricky, and now that I'm more on the hiring side, I understand it a little bit better. I think usually when you're offered a salary amount, and it varies agency to agency, but that person who's explaining to you the offer usually has a little bit of wiggle room, usually within like a maybe $1,000 or $2,000 or $3,000, something like that. Maybe it's within like 5% of the salary. But if you're looking for something that's above and beyond that, usually they have to go back and get approval. They may actually not be able to increase the amount they offer you at all during that phone call. So depending on how much of a difference it is, they may need to take that back. They may need to get special approval from the hiring manager if they're comfortable with the amount that you have in mind, or it may require multiple people to sign off on. So I would say usually the number that is offered is within a few $1,000s of where they're going to be. But I've also had experience where they just say, like, this is it, this is the amount that we're able to offer you, and there's really not a lot of wiggle room. So I think it depends agency to agency, but I do think there's a lot of value in trying to advocate for yourself and, asking them, if they can get up to this other number that you have in mind, provide examples of, you're nearing graduation or you just graduated and you have to pay for student loans, things like that. Sometimes people are willing to work and to be a little bit outside of the box. Sometimes I know that salary is the big one that we think about, but sometimes companies are more able to negotiate things like vacation time, or in some cases I've had the opportunity to offer like a small bonus. So it's just kind of like a one-time dollar amount of, maybe it's like $1,000 or something like that. So if you try to brainstorm with that person, if they're not able to get you to the number that you want for your salary, but there are other things that can be done, really just sort of, asking a lot of questions and seeing if there are other areas that could make the offer more enticing to you.
This is Angela. I'll just say too, like, it also depends. It's a little tricky, I feel like, if you're in a position where you don't have a job and you do need an income to then start thinking about negotiating salaries. I always think it's worth the ask if they're able to do it. It was not something I had been really ever used to doing when I started working professionally. One of my coworkers had suggested, like, if you want to try to get more, that like asking, and I don't know if this is a good rule of thumb or not, but asking, for like 4% more than what they were offering you, just to start from there. And then I would just say, if you do have a job, one of the things is when I was working for Arizona Community Action Association, and I went to go work with Kyrsten when she was Congresswoman in the House, they had actually offered me less money than what I had been making. And I was like kind of devastated about it because I really wanted to work for her. And before I knew it, it just kind of came out of my mouth. Like when they told me how much, I was like, is that negotiable? And they were like, well, yes, think about it for the next day and give me a call tomorrow. And when I called, similar to what Cameron just said, I told them how much I was currently making, and told them that I really, really wanted this job, and would they be willing to pay, kind of meet me in the middle of what I was looking for. And fortunately for me, my job also, at that time, they did student loan reimbursement. So that was another benefit that wasn't part of my salary, but also they paid $600 towards my student loans at the time. But that, fortunately, it also turned out, because I had that conversation, I found out I had just applied as a congressional caseworker, and I found out that the person who was going to be my supervisor was actually leaving in 2 weeks. She was a military spouse, and they were moving across the world. And they're like, well, we can bring you in at this much, but we're actually planning on making you the director. And at that time, we can give you a little more than what you're making now. So sometimes having that conversation can lead to other things that you didn't know about that might be available. So in my opinion, it's always worth asking. I do know if you apply for like state jobs and county jobs, they kind of give this like crazy range of like $17 to $35 an hour. And from my experience, they're not super flexible. It's whatever the lowest one is what they can kind of pay you. And that the range comes from if somebody was working already for the county in a different position and wanted to take over your position, then that allows them to have more of a range to what to give them. Or I guess if you've worked for the county before, they can bring you in a little higher. So sometimes you see that range and you get a little excited thinking, oh, I could make $35 an hour working here, and then they offer you 17. That happened to me. But like also just knowing like if it's acceptable, will it get me by? And you know, my goal is always similar. I think Cameron also said it too, is if I really like an agency, get in there and then try to promote from within as well.
Awesome. Great. Thank you, Angela, for that feedback. We also got a couple of follow-up salary negotiation questions. One being, do you have any resources about learning how to do it successfully or what the best approach is? And I just wanted to make a shameless plug that Career and Professional Development Services is a great way to do that. And Natalie will be touching up a little bit on our resources and how you can connect with a career and industry specialist. You can even come in with your actual offer and we can walk it through with you, what that conversation might look like with that individual when you reach back out to them, who might be your supervisor giving you that offer. So we do have time for maybe 1 or 2 more questions before I give it back to Natalie. But we did have a question about LMSW versus an MSW. So can you talk about the importance of each of these in the positions you hold? How valued is the license? If you obtain your license, how did you or could you use it in your workplace as a vehicle for getting your license?
So this is April. I did go ahead and decide to get my license. That was because, you know, I was, as I said, I was doing kind of a hybrid job, and I felt that that would be important to my professional development. I also had an agency that was supportive of seeing us do that, and that if I did do that, that they would increase my salary. But I've always found it a benefit. I know there's, you know, a discussion in the PAC community about, do we need that or is it necessary? For me, it's always been something that has been a benefit to me, because I did have an interest in and was actively doing a lot of work, direct practice work at the same time as doing my PAC work. And I also like that it, because you're doing continuing education, it does require you to keep up on some things. And so having that kind of push or that responsibility was helpful to me. And Ability 360 does pay for my license renewal and does pay for our continuing education. So that's a nice benefit that they provide us.
This is Cameron. I personally did not pursue licensure. I was more interested and continue to be more interested in the operations and the program development side. I probably have missed out on some job opportunities and probably even make a little bit less money than I could if I had my LMSW or my LCSW. But to me, being on the behavioral health and integrated side, just by having that licensure, you end up sort of getting maybe pushed or directed a little bit towards the way of reviewing clinical documents or being in more of a clinical role. And we, as a system, we need those people. We definitely need more of them. I just personally am not interested in heading in that direction. So I have continued in my career path, not having pursued licensure, and at this time I still don't have a plan to do so. So that's just very much a personal choice. I would not necessarily encourage someone to follow that. That's just what I chose for myself.
And this is Angela. I also am not licensed. I think when you're in school, you hear about it a lot, and I feel like it kind of like freaks you out, like I have to get licensed, I have to get licensed. And again, I would never encourage somebody not to get licensed, but I supervise like 8 social workers, and one person is licensed in California, but not in Arizona. And for me, it's more of like a cost issue. Is paying for my license. It's not required for my position. And so it's more of the cost avenue of it, of paying to get licensed and paying to keep my license. We were looking at it, and I'm still working with like our HR to see if they would pay for it now that we're in the Senate. And they seem to be confused about what that means and seem to think I'm asking about going back to school. But if it's something that my job might offer to pay for, like I did order the book like over a year ago, like one of those little like work study books that they have, to look at it. And a lot of it actually doesn't apply to what I currently do, but I also just like to be like a continuous learner. But I also take opportunities when I do see other continuing education stuff going on. If I'm interested in it, I just sign up and go to that kind of stuff. I had no experience prior to this working with veterans, and I worked for the senator when she was in Congress, and we had an issue with the Phoenix VA where all of a sudden I had to dive in and learn all about veteran culture and military culture. So I went to a lot of the CEUs. So I do think it's important to stay kind of updated with that kind of information. But I am not personally licensed either.
Great. Thank you all for contributing to that question. We're going to have one more question, then I'm going to hand it over to Natalie, but maybe we can have just one of our panelists speak to this one if one of you feels a little bit more excitement than the other to respond to it. But we have a question. Are there any agencies in particular that come to mind that are more progressive or creative in the sense maybe of that culture, or they're known for those types of descriptor words, and within their values of this culture that might have PAC positions? They're not looking for any specific population, but they're just kind of looking for your insights. If you can think of any organizations that come top of mind.
Yeah, I could start off just in reaching out to colleagues and things like that. There are a few agencies that come to mind. And again, I want to preface this with saying, you know, as you read through some of these job descriptions, they may not all 100% jump out at you as something that, you know, a PAC focus or a PAC student would do. But these are agencies that have a very good culture, that have been around for a long time, that do great work that I've worked with for years. So a few of those agencies are Southwest Behavioral and Health Services. They're throughout the entire state. They have a huge focus on integrated care. They serve children and adults, pretty much all populations. Another agency, Jewish Family and Children's Service. They started out and continue to have funding through the Jewish faith, but they're essentially a non-denominational care provider. They offer a lot of integrated clinics and a bunch of different services in Maricopa County primarily. although they have a sister agency that's in Southern Arizona that's also called Jewish Family and Children's Service. But they do great work. Taros Health is another agency that has a lot of different services offered. They're throughout the state in different areas. They're not in every single county, but they're beyond Maricopa County. And then an agency called Child and Family Support Services, which is in the Phoenix area. They're in Tucson and they're in Flagstaff. And they just have, I really respect their culture. I've worked with them for a long time. I pretty frequently speak to their leadership, and they just always have a lot of insight in the way that they approach working with children and families, as well as just the way that they help to train and grow their staff. I've been impressed with each of these agencies, so I would recommend them. And then if you're interested in more of the direct care route, at least in the beginning, there's another agency called Southwest Network, which is where I started as a children's high needs case manager. And they have fabulous training. They do a great job. I think that I've been able to be successful in this field because that's where I started working, and they did such a good job of training and developing me.
That's awesome, Cameron. Thank you so much for the recommendations. All right, I'm going to wrap up the Q&A section for right now, and I'm going to hand it back off to our career and industry specialist, Natalie McIntyre.
Thank you, Sarah Jo, and thank you all for those responses. Thank you for the questions. We do kind of want to wrap up today, though, just giving you an opportunity for follow-up if you do have any additional questions. I know our panelists have offered their information, which they can feel free to share that in the chat as well. I know that is in the handshake event, but feel free to reach out to our office, and here you will see our website. So that's career.asu.edu. Specifically, I'd love to point to our virtual resources that we have right now. I know a couple of questions surrounded salary negotiation, maybe even that resume prep, that LinkedIn profile. I know someone mentioned the mentorship piece and how valuable that is, that networking. So utilizing LinkedIn to its fullest capability. So we would love to chat with you about that in our office here in Career and Professional Development Services. You can schedule appointments with us at asu.joinhandshake.com. But absolutely feel free to reach out with any questions, follow up. You can see our email address there as well. But once again, I do want to thank our panelists. Thank you for taking time out of your day, sharing your perspectives. And I know it's, again, invaluable to our students, our alumni here at ASU. So thank you all, and that'll conclude our panel for today. Thank you, guys.
Thank you. Congrats to all the future graduates.
Bye-bye.
Thank you.
Thanks, everybody.
Thank you.